Hi friends, I am Dr. Abhishek Shah, working in Leelavati Hospital and Research Center as a cardiologist. So we are here today to discuss on sudden cardiac death, since October being the month of sudden cardiac death awareness month. So regarding the incidence of sudden cardiac death, in a normal population this is around 0.04 to 1.1%, but in patients whose relatives have got sudden cardiac death, the incidence increases by 4 to 5 times than the general population. So this is the population which has to take utmost care and get their cardiac health checkup routinely done. So once a patient has a cardiac arrest, immediate care in the form of CPR, that is cardiopulmonary resuscitation, is very important. The earliest care which we can give saves the life expectancy of the patient. So the golden time would be to give an immediate CPR and a defibrillation to save a patient's life. So in day-to-day life, we get many myths whether CPR can be performed following a patient who has undergone a bypass surgery or who has undergone a pacemaker. So actually these patients are more at risk of developing sudden cardiac death, and they are more vulnerable, and they should receive an effective CPR as early as possible. There is no contraindication for them to have an effective CPR in any instance of a sudden cardiac death. Let's talk something on the life expectancy following a sudden cardiac arrest. If a patient with sudden cardiac arrest gets an immediate cardiopulmonary resuscitation and a defibrillation, and we can achieve the cardiac rhythm immediately in time, the patients can have a near normal life expectancy. Usually the blood supply to the brain, when put on halt, can withstand the insult for 3 to 4 minutes. After that, the brain starts getting affected, and the life expectancy for a CPR, if given lately, is less. So there is no particular time for a cardiac arrest. It can happen anytime and anywhere, and that's why we have to be vigilant. But with all the studies and all the data we have, we've seen that morning 6 a.m. to 12 noon is the commonest time for patients to have sudden cardiac arrest. Cardiopulmonary resuscitation is a very effective method to save a patient from sudden cardiac arrest. It's my humble request to all the people around that we should learn the basic life sciences, the life care support, and if possible the advanced life care support, so that we can give an effective cardiopulmonary resuscitation. The biggest challenge is that lack of knowledge. A CPR given effectively, the chest excursion should be at least 2 centimeters. We have to give adequate time for the chest to recoil back before the next CPR, and the number of breaths and the cardiac massage has to be synchronized. So that is the biggest challenge, that people should be aware on how to give an effective cardiopulmonary resuscitation and defibrillation if needed. It is quite possible for a person to live a normal life following a sudden cardiac arrest if he has achieved CPR in time. If there is a delay in the CPR, the blood supply to the brain reduces, then the quality of life is impaired. Otherwise, they can live a near normal life following a sudden cardiac arrest. Usually during a CPR, cardiopulmonary resuscitation, the lungs are not damaged. Basically, the CPR is to maintain the circulation and the breathing so that the oxygenated blood reaches the brain. In case if the CPR is not given effectively, if the people giving CPR are not well trained enough, they can cause damage to the ribs, and this ribs can cause damage to the lungs. Otherwise, it should not. So nowadays with the recent advances, the prognosis in patients who survive a first cardiac arrest is better, because we have machine called as an automated intracardiac defibrillator, which is a very small device just like a pacemaker. It has to be implanted under the chest wall. It detects the rhythms which are such as ventricular tachycardia, ventricular fibrillation, which leads to sudden cardiac death, and they give shock in time so that a sudden cardiac arrest can be prevented. So early detection of this sudden cardiac death or patients who are at risk of sudden cardiac death, and timely offering the treatment in the form of a AICD, that is automated intracardiac defibrillator, can improve the prognosis of such patients to a very large extent. Usually children are not at a higher risk of sudden cardiac death, but children who have a congenital cardiac disease or any genetic diseases, they are at a risk of sudden cardiac death. So my message to the population would be to keep a healthy lifestyle first and foremost, and to do a routine cardiac health checkup on a regular basis, so that we can save such episodes of sudden cardiac death and help the population.